All right, good morning. Let's talk about beep, 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 beep. You know, those things that you see in the movies when somebody's heart is pumping and, you know, they've hooked up to all these machines and all of a sudden beep, 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 beep. It goes faster and faster because the heart's beating faster and faster. How does that work? How does that happen? Okay, so we've talked about the cardiac cycle before. Whoops, wrong thing. We've talked about the cardiac cycle before, and the cardiac cycle is what happens in your heart over one complete heartbeat. Remember, it's a period, it's systole and diastole, so the heart is contracting and relaxing. First the atriums contract, the ventricles contract, then they relax. So this all happens because of some electrical activity that moves from the SA node to the AV node. And so this particular measurement that we see right here, this little graph, this little image, is called an ECG. Stands for electro, because it's measuring electrical activity, cardio, because it's talking about the heart, and gram. So a gram is like a piece of information. Okay, so this is measuring the electrical activity of the heart, and it's giving us information in a visual way, which is why we can call it a gram, like a graph, not gram like in weight. Okay, think of like a telegram. You know, you guys send telegrams, right? Okay. All right, so let's draw in our notes this little picture here where we're going to have a straight line, a little bit of a peak, a little bit of a flat line, then a drop, increase, below drop, and then come back up, and then boom. So this part right here should be a little higher than this part right here. And this part should be kind of thin, but go really high. Let's label these different things. We've got our P wave, which comes first, a PR interval, because it's in between the P and the R. I don't know why they leave out the Q, but that's cool, whatever. And then we have this thing called a QRS complex. A complex is just when multiple things work together in something. Like if you live in an apartment complex, it's a bunch of different apartments all working together. Okay. The lower part is the Q, then the R, then the S. Then we have a little ST area in between the S and the T, and then we have a T wave. So the key components here are a P wave, a QRS complex, and a T wave with a little bit of a line in between the P and the T and the middle part. All right. Let's remember all the way back to when we did neurons. We used a couple of words. One of those is depolarization. And depolarization happens when the inside becomes positive with respect to the outside. All right. So that's going to be really important in this part. So they stick these little things on you in a bunch of different parts that measure how the electrical signal is traveling. Those are connected to wires, which are connected to a machine, which interprets this whole thing. Okay, so let's talk about the P wave. This is when your atrium depolarizes. So your atrium depolarizes and contracts. Just like with your nerves, the nerves only work when the inside is positive with respect to the outside. Your muscles are the same way. The nerves connecting to your muscles are the same way. They will act when they become positive. This is due to a signal from the SA node from a couple of days ago. So it would be really good to pay attention to the notes from a few days ago about how the electrical activity of the heart works. Okay, so the atriums contract. Then we get a little bit of a gap to allow for blood flow. So the PR interval is that delay. It's that delay between the SA and the AV node to allow for blood flow. Then we have our big QRS complex. We could copy almost the exact same definition from the P wave over here, but instead of the atrium contracting, this is the ventricle depolarizes and contracts due to a signal from the AV node. All right. Then we get once again, our little segment here, our little delay to allow for blood flow. So this delay allows for blood flow. And then we get our T wave. This is the repolarization of the ventricles. Remember, these ventricles are big. They require a bit more time, and they're so big and they do so much that this is actually like really measurable. Repolarization is the opposite of depolarization. It's when the inside becomes negative with respect to the outside. That's why this goes the way it does. So that is a typical normal ECG. Let's add in a picture about some common problems here. All right. So here we go. Okay. So here's your normal ECG is right here. There's something called arrhythmia, means that the rhythm is irregular. So let's pay attention to what's happening here. If your heartbeat should be about 60 to 100 beats per minute and beating pretty consistently, pretty regularly, we can see a couple spots in here where we've got a short interval between these two beats, a long interval between these two beats, and another short interval between these two beats. You're out of order. You're out of rhythm. You are arrhythmic. So this is all of the complexes are normal. We've got our P wave. We still have our P, then our QRS, then our T, but the spaces between them are off. Brachycardia is a slow heartbeat. Too slow. All of our complexes are normal. We still have our P, QRS, T, but the rate is too slow. So the space between them is too long. We have tachycardia, which is the opposite of brachycardia. Tachycardia, the complexes are all normal, but the rate is above 100 beats per minute. 100 beats per minute. We have finally atrial and ventricular fibrillations. You can see that here we have a lot of action with our normally interspersed ventricle action. This means that your atriums are just contracting, but not in the right rhythm. It's not atrium, ventricle, atrium, ventricle, atrium, ventricle. It's atrium, 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 ventricle, atrium, 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 ventricle, and that's problematic. So this is atrial fibrillation, ventricular fibrillation. We almost can't even see the atrium contracting at all, and this is a problem. The problem with both of these is that the system really needs to work perfectly. The atrium needs to contract, followed by the ventricle contracting. If the ventricle just keeps contracting, it's not pumping out enough blood to keep all of the other blood moving forward. And so as a result, you're not getting enough blood to different parts of your body. The only thing that's not shown on this picture is when your heart just stops beating, and that is when there's no peaks at all on any of these. As you know, if you have some problems with your heartbeat, you can get a pacemaker. And a pacemaker is a real interesting piece of equipment in which let's draw ourselves a little chest here. All right, so we're going to have our heart. I actually need to draw like a pretty good heart for this. Oops, I already messed up here. So let's draw ourselves a little heart. Yours does not have to be as accurate as mine is. Here we go. This is better. But try to get the shape pretty close. There we go. Okay. So in an artificial pacemaker, you put the little device here. It's an electrical device that has batteries coming out of it. And you'll thread, this is really interesting, you thread it into the superior vena cava. I'm going to redraw how I have my superior vena cava here. All right, here's my inferior, here's my superior vena cava. I shouldn't close that off so much. Okay, you actually thread it into your superior vena cava, and so you get a tube that comes in here, and then a second one, so there's actually two wires that come out of this, comes down here, and this acts as your SA node and your AV node to keep you going. It's really, really neat. So if all else fails with a heartbeat, you know that they also use those machines called paddles, or the paddles, where they put on you and they go clear, and then all of a sudden you jump off the table and all that kind of stuff. So that is called a defibrillator. And a defibrillator is designed to depolarize the whole heart. Designed to depolarize the whole heart. And when it depolarizes the whole heart, hopefully normal, and this is why we try to do this. Hopefully the SA node reestablishes a normal heartbeat. And that's it for the heart. One of the other things you're going to do, as far as activity-wise here, has to do with what happens with some other disorders of like heart disease, and we're specifically going to be talking about when you get build up in your blood vessels. After this, we only need to talk about the liver and your immune system, and then we are on to our last unit of the year. All right, that's it. Take it easy.